October is Breast Cancer Awareness Month, and we are talking to a local nonprofit about the change that they're making in women's lives. From early detection to life-saving support, their work is closing the gap in care when it matters the most. Let's go on the record.
You're watching On the Record on WPBF 25.
October is Breast Cancer Awareness Month, a reminder that early detection is the most powerful tool when it comes to fighting breast cancer. And this morning, we are talking to a nonprofit who has made it their mission to improve the outcome and reduce deaths from breast cancer, cervical cancer, cancers that women face each and every day in Palm Beach County. So joining me now is the founder of the Promise Fund, Nancy Brinker. Nancy, thank you so much for being with us. This adventure for you, very personal when it comes to helping women. Tell us how this all started.
Well, my voyage in breast cancer and everything started in 1980 when my sister died of breast cancer, Susan Komen. And for years we'd funded research. And then it became very obvious to me that one of the real problems was meeting the disease head on and educating people, because we know that early detection works. People who have early detection and find the disease at a treatable stage, the survival rate is very high. So that's what we do at the Promise Fund. We created a fund where we would make sure women were guided and navigated to different places where they would get mammography and cervical cancer checks. And then after that, we would treat them if we had to. We would find treatment, and if they couldn't find it themselves, and it's working really well. So far, we've helped 17,000 women in our county and going.
It's really grown for the past couple of years, too.
Yes, it's grown. People are recognizing it. We want to be there for people. And we're getting the systems working very, very well.
Okay, so you've recently expanded the health programs by opening 3 new sites. 2 of them are in Palm Beach County. Can you tell us about those?
Well, one of them is in a, they're incredible. One of them is in a store, kind of a storefront. The rest are in community centers. FQHCs have community centers, sort of spin-offs in different places. And so we have them in, and they're working very well. People are coming in. We've so far helped over the last 7 or 8 years over something like 17,000 women get screened, and some of them had early disease, some of them didn't, some of them are watched, and we offer them to come back every year or before if they have to and have their screening.
And you were sharing with me the numbers of people just in our area who do not have health care, who cannot walk in and get a mammogram without facing a big bill.
Right. Well, they can with us. They can go to their community health center. We have 4 of them now operative, the Promise Fund, and they can go in and make an appointment to have a mammogram, and then they, find the outcomes, and if they need treatment, if they need care, we will be walking side by side to give it to them, and also help with the financial side if we need to.
We hope someone watching this program decides, I really do need to go get my mammogram. And maybe they have health care, or maybe they don't, maybe they go through the Promise Fund. But there had been some confusion in the last 5 or 6 years about when women should get a mammogram.
Well, most, sort of the agreement that goes around in the general public is that at age 40. Now, when you could be at risk, for example, my sister died at a very early age of breast cancer many years ago, and then they told me that I would be at risk before I was 40. And at 35, they started doing mammography because they were worried it was genetic. Indeed, it was. And therefore, that's why we start earlier with some patients, but basically around the age of 40, backing up to 35 if a woman has some symptoms and or family issues to do it.
And so you've done this, you said roughly 17,000 people. Are there any stories that have really stuck with you?
Yeah, the stories that stick with me stick every single day. To help people who haven't had access to care. And we have about 100,000 women in Palm Beach County who don't have health insurance. It's a real awakening. And then the relationship with the federally qualified healthcare system, which many Americans don't know about, is a blessing here in Palm Beach County. And so that in a couple of their locations, we now have mammography equipment. We want to make it a part of their yearly physical. And honestly, it's working. And I'm so happy. And we know that there are places in the country that want to replicate what we're doing. And really what this does is shift a lot of if not the cost, a lot of the concern to the community. The federal government cannot do health care for everybody in communities. Communities need to do that and get people to come in and, avoid some of the most dangerous diseases by early detection, and breast cancer is one of them.
Okay, so you've talked about how much you've grown. Where do you see it going from here? Our community is not slowing down. We talk about, the Treasure Coast, for example, just booming. And
Yes.
so many people have moved down here, which means there are more people who do need help. So
Right.
where do you see the Promise Fund going?
We have risk in really all of the big Florida towns, as well as Miami. We want to go there. We'll probably be going there next. Some of the other Tampa. We might go up to Jacksonville if wanted. This is done by a community, and then what we're looking for are more federal grants that we can add to it, and then what we hope more community grants. And it's such a good feeling when you find out not that a woman has an early disease, but that we've conquered it, so she doesn't have that problem, because it can be a long, unsuccessful journey allowing a disease like breast cancer to grow.
And what I'd like to get across here is there's no excuse.
Yeah.
No excuse.
No
not
excuse.
To get
No
screened.
excuses. Yeah, no excuse. And a lot of the people, when we first opened this program, were kind of went into a shell for a little bit. We said, no. We have thought this all the way through. Sure. I myself had breast cancer when I was younger. My sister was Susan Komen and died of it. I saw what happened when people die early of this disease. And we're not going to let that happen.
That's right. You're doing so much. Nancy Burton, thank you so much. We
Thank
really
you.
appreciate your time right here. Well, coming up next, we are going to talk to a breast cancer patient. She's going to share her personal journey with us, the role Promise Fund has played, and her message to you out there. We'll be right back.
You're watching On the Record on WPBF 25.
I'm now joined by a breast cancer patient, Anna Dominguez. We want to thank you, Anna, for being here with us and sharing your story. All right, we're going to start from the beginning. Take us back about a year and a half ago. It's when you just started to not really feel very well.
Yes, I remember that the feelings that I have is like, I don't know what's going on with me. The pain on my whole body, my legs, and I wonder what's going on with me. So I went to the ER, and they don't find anything. They do the CT scan, and they don't find anything. They just put a painkiller and send me home. And after that, I continue with my body. The unhealthy, like, is my back, my shoulders, my legs. So I don't feel me. And I wonder what's going on with me.
As women, I feel like we're always just pushing through. We got to keep going. We got to keep running the household. We got to keep doing what we need to do.
Yes, especially the kids.
Oh, absolutely. We have to push through it to put a lot of our own needs behind us. What made you finally think, I'm going to get a mammogram?
Actually, that day I finished working, and I went to get some food. And this girl approached me politely and said, "Can I ask you something?" And she said, "When was your last mammogram?" And I say, "I never have a mammogram." She say, "Why?" And I say, "Oh, because I think I don't need it. It's not in my family." So, and she say, "No, but you have to, because it's for your own health." And I say, "I don't think so." But she don't quit on me, so she insists, "No, you have to have the mammogram."
And you didn't know this woman?
Nope. No. She just come to me and asked. So, and she politely asked for my phone number, and I give her my phone number, and I say, "Okay, you got my phone number." And she said, "We want to be in contact with you." And after 2 days, they called me back. They told me, and they made the appointment, the time, and they say, "Don't worry about transportation, because we're gonna get you." So they make sure that everything for you work well. So, and I said, "Okay, thank you." So I went to the fair, the mobile mammogram. The day I met Davis, that is the lady who worked for me. Is one of my angels. And the first girl, her name is Jarlene Suarez. So and after that, I went to my first mammogram.
And so just to make it clear, this was getting help through the Promise Fund, as
Yes,
we've been
Promise
talking about.
Fund, yes.
So they provided everything from transportation, and you went.
The appointments, everything, they work for you.
And so when you get the diagnosis, what was going through your mind?
Listen, first was like, listen, you have something, but we're not sure. We want to make sure. So they do the second appointment for me, and they do it, and they say to me again, don't worry about transportation, because I always say I'm working.
Sure,
so,
yeah, we're busy. Yeah, it's hard to
yeah.
just
So
stop
they
life.
say, don't worry, we get you. And I say, okay. So they do the appointment for me, and I went to the appointment at the hospital, and definitely they say, yes, it's this, don't worry, we're gonna take care of you. So, and this is one thing that make you less worry, because you have somebody that take care of you and push you to go forward. And I'm so shy. I don't like to talk, but I Davis, the Promise Fund girl, she's on top of me. Don't get bored. Don't be afraid. We're gonna work for you, and everything's gonna be fine.
And you had a patient advocate, someone who knows the process, knows what's going on, can maybe help lessen your fears and your worries.
Yes, for sure. It's not only her. It's a organization that through her work with me and for me, and I'm really happy, because at this moment I don't know what to do if they don't push me to go through.
And so tell us about your treatment right now. You're in the middle of treatments right now.
Yes, like I say, at first when I received my my news, and I say, you know what, I want to quit. You say, no, no, we get you. We're gonna go through everything. We're gonna take care of that. Don't worry. No. And one thing that made me be like, yes, they work with me. You know, 2 years ago, I applied for Medicaid, and they denied the help, because I want to know what's going on with me. So when she say, don't worry about anything, we got you. So I felt little, yes, they got me, just my hand. She always called me, how are you, how you feel today. So it's not like, oh, you are one of the 100. No. They take care of you.
Yeah, you meant something to them, and I know they mean a lot to you.
Yes.
You're a mother of 3, a strong woman. I know you said you were shy, but let me tell you, coming on this today and talking about this, I have a feeling that someone is thinking,
the
that's
same
me.
position
Yeah,
of me, yes.
Absolutely. Well, we will be praying for you that I have a feeling you're going to make it through this wonderfully. It's all going to be great. Anna, thanks for sharing your story. Really appreciate it.
Thank you, Promise Fund.
Oh, yeah.
.org. Yes.
They help a lot of people. I'm glad they were able to help you. And that angel
Yes,
who said hello to you that day, it was meant to be. All right, Anna, thank you so much. Well, coming up next, we learn about Promise Fund's Patient Navigator, why this role is so critical and how it's helping to save lives. Welcome back. We are now joined by Karen Patty, the Chief Operating Officer of Promise Fund. Thank you so much for being with us. We want to start a little bit about talking about your role as COO and what it means and how you help so many people in our community.
Well, thank you for having us today, Erin.
Of course.
So as the Chief Operating Officer, my job is to make sure that everything operates smoothly, that we're in great communication with our healthcare partners, with any of our community partners that we're working with, and really ensuring that I'm bringing our founder, Nancy Brinker's vision to life, and to make sure that everyone knows about the Promise Fund and has access to our program in our community.
You know, and I think what's so amazing is the fact that, you know, it's not an easy process when you find out, oh my gosh, I've been diagnosed with breast cancer. What do I do now? And so to have an advocate, to have these navigators who are able to bring them along with the steps, not only with the doctor's appointments, but with just mental health support.
Yes.
It's pivotal in the recovery, really.
Absolutely. And I think what we realized initially, getting access to care is one thing, but having someone to walk alongside you in the journey is another. So our navigators really live and work in the communities that they serve. They're aware of all the resources that exist in the community. They help our participants access screenings and then diagnostics and treatment if necessary. And they really help them overcome any barriers that might pop up along the way, like transportation, language, financial assistance, enrolling in health insurance, and much more.
Yeah, we were just hearing from a patient who you guys really, I mean, made everything possible for her diagnosis to come to light. And she said it was so nice just to get a phone call. How are you? And someone who really, truly cared about them.
No, our navigators really become trusted friends. Yeah, with our participants, and they build that trust, and they know that the navigator is never going to leave their side, and they know that no matter what happens, the navigator will always be there to support not only them but their families as well.
Can you have any stories that kind of stick out in your mind? Because I know
I do.
She was sharing over 17,000 people that you have helped.
We were at a community event, and I was with our founder, Nancy, and we had a table set up, and we were doing outreach and education and educating on women on the importance of early detection and screening. And a woman came over to the table, and she said, "Are you responsible for this?" meaning the Promise Fund. And I said, "Well, our founder is right here." So I walked her over to Nancy, and she, with tears in her eyes, said, "Thank you for saving my life."
Wow.
She said that she had not had a mammogram ever before, and she happened to connect with the Promise Fund, who helped set her up with a mammogram, and she had an abnormal result that ended up being a stage 1 breast cancer. Thankfully, she's doing well, and she survived, but she's a mom of young children, and she said without the Promise Fund, she could have lost her life, and now she can go back to living her life with her children and being a mom and getting back to work, and she's just grateful for the services that we were able to connect her with.
One of the many success stories.
Yes.
Cancer doesn't discriminate.
No.
It doesn't matter how much money you have, how little money you have, race, gender, whatever. How has the Promise Fund really helped health equity to make sure that everyone in underserved communities are getting the detection and the treatments that they need?
Well, I think since our navigators are so connected with the communities that they serve, they know where the gaps are. So they're really working hard to maybe do pop-up events in those neighborhoods and really getting out there and digging into areas that may need more assistance, or to people who might not know about screening guidelines. They're always changing. So it's important that everyone know what the new screening guidelines are and making sure that they're getting screened on time. So I think that we're really identifying needs in the community and targeting those specific areas and making sure that those individuals have that help.
I want to talk a little bit more about who are these navigators, what kind of training do they do, and maybe someone watching is saying, wow, maybe that's a place I can help.
Absolutely. So our navigators are really trusted members of the community. So they live and work in the areas in which they serve. They're all bilingual. So we ensure that they have training in breast and cervical health and advocacy, and also in patient navigation. So we also have an ambassador program where members of the community can join our efforts and be trained to be ambassadors and to spread the word about the Promise Fund. And certainly if anyone is interested in being a Promise Fund ambassador, we would love to have them.
All right, where do you see the Promise Fund in 3 to 5 years?
Well, right now we're looking to replicate our navigation in different communities. Right now we're in Martin, Palm Beach, and Broward counties. So we're looking to expand the navigation hopefully throughout the state, and nationally this could be used as a blueprint to replicate throughout the United States. So.
Yeah, we do some really great things. Hopefully you have people reach out to you, and hopefully someone watching this today says, okay, you know what? I need to get my mammogram.
Yes, absolutely.
Hopefully,
Thank you.
At least one person. All right, thank you so much
Thank
for being
you.
with us. On the Record, we'll be right back. We want to thank you for making us part of your morning. As always, we encourage you to be part of our discussion each and every Sunday right here at 10 a.m. Until then, you can watch this morning's On the Record and every episode on our website, WPBF.com, and on our free WPBF 25 News app. Have a wonderful Sunday, and we'll see you again next Sunday.